Australian company says it has developed a 3-minute COVID-19 breath test and is seeking government funding for mass manufacture by the end of the year. Well, that's extraordinary.
Brilliant.
It's not an Australian company, is it? It's a Melbourne company. Samantha Ollerton, CEO of GreyScan. Samantha, good morning. You're a Melbourne company?
Good morning, gentlemen. Yes, we are born and bred in Australia and based in Port Melbourne.
Okay, so if you've got a 3-minute COVID-19 breath test, that's pretty special. Tell us about it.
Yeah, I mean, what our focus has been on really removing the intrusive nature of testing. Right now, to get a rapid testing done, you have to have a very intrusive stick up your nose or down your throat. And for many potential patients or people to be screened, such as in aided healthcare, where this can be an extremely traumatic experience, it's something that's a lot more user-friendly, it's fast, it's accurate, and one of the key differentiators with this test is that it tests for infectivity. And that's going to be key for us being able to open up the borders, get back to business, and really get through this next year.
How accurate?
How accurate? Well, we are targeting false alarm rates that are going to be in the realm acceptable and comparable with the laboratory tests, which are traditionally PCR. We repurposed this technology from explosive detection, so we're very well used to making technology that has.
So you're saying it's going to be?
You're
saying it's going to be as accurate as the sticking the thing down the back of your throat and your nose?
Oh, it's absolutely, yes. And the key thing is that we're not actually being intrusive in the testing, as well as then understanding how infectious somebody is. Because right now, all we're testing for is whether somebody has a fragment or a part of a COVID virus in your body, not whether you're actually going to get somebody sick by being infectious.
So, Samantha, in your experience, how easy is it to get your hands on government funding? What process do you have to go through?
It's quite a long process. I mean, there's a lot of advocacy that's required, getting the ministers and understanding the various requirements and regulation, and really helping to drive standards. After all, this is going to be a combination of vaccines, antibody testing, the breathalyser test that we're making. Having these different test regimes implemented is the key to moving forward. So we're looking at all sorts of different routes to funding for manufacturing, for supply chain management and commercialization. And what we want to do is build up the capacity in Port Melbourne, build an Australian product in Port Melbourne, and not only protect the Australian people, but ship and export it to the rest of the world.
And Samantha, we saw, a couple of weeks ago, a Brisbane firm. They didn't receive funding from our federal government, but they got, I think it was $300 million from the US, which was disappointing on the one hand, but at least they got the money. Are you seeking international funds as well?
Absolutely, exactly the same funding streams. The Americans have been very proactive, as usual, when it comes to funding companies with good solutions. So we're hoping to secure funding via both routes, and primarily to keep the manufacturing in Australia and to create Australian jobs, which is our primary objective.
Good on you, Samantha.
Yeah.
Plus, I can tell whether you're fit to drive a car. Couldn't you?
Yes.
Imagine all the things you could have
totally.
One-stop shop breath tests. Now, I imagine the natural home of that product, provided they get the funding that it's developed, natural home would be an airport.
Yeah. Just breathe here before you can get on the plane.
And before you can get off.
The technology isn't new. A roadside test in use for decades combined with a machine currently used to find bombs. But in the fight against COVID, it's revolutionary.
Just blow into this, it tells you whether you have COVID, potentially tells you what other viruses that you have, and potentially gives you information on how infectious you are. So this is a massive game changer all in 30 seconds.
GreyScan has adapted its explosive detection device to detect viruses instead. It says the breath test is far less invasive than the current nasal test, yet provides far more information.
Being able to not only measure how much virus comes out, but understand whether that virus is a fragment of a virus, whether it's a dead virus, or whether it's a live virus.
The results would be instantly uploaded to a cloud so health officials can map every case. The company says it could be used at events like the tennis, but more importantly could easily be operated by airport staff, allowing our borders to stay open.
Imagine getting onto an aeroplane and having that feeling of, is someone who have COVID? If you have a breathalyser test when you walk in, you know everyone who's on that plane doesn't have it.
But GreyScan says it won't start making the kits until the federal government agrees to buy them.
We need from the government a commitment to help us get to the next stage.
GreyScan hopes to secure government funding within the next few months, and if it does, it says it can be manufacturing these tests here in Melbourne by the end of the year. And once the technology is rolled out in Australia, the world will be next. Laurel Irving, 7 News.
Many Australians are familiar with the coronavirus swabbing process involving a quick stick up the nose and down the throat. Now, Port Melbourne company GreyScan is aiming to reduce the irritation and cut the wait time for results with a COVID breath test in development.
By having a non-intrusive test, you can actually have a very comfortable experience.
It would be administered like a roadside alcohol test. Individuals exhale into a breathalyser, which will capture virus particles coming from the lungs or nasal passages. A breath sample will then be inserted into a portable analyzer, returning a positive or negative result in 3 minutes. Current PCR swabs do not differentiate between infective and non-infective virus in the body, in other words, the charts of transmission. In contrast, the GreyScan test is being developed to measure infectivity, the risk of spread.
We can tell the difference between a fragment of a virus, a live virus, or a dead virus.
Overseas investors, including the US, are already sniffing around the project, but the developers are hoping for local funding support so that the technology can be rolled out across Australia first. Dogs are also snuffling out the coronavirus as part of a research trial. The University of Adelaide and Australian Border Force have trained 14 Labradors to detect COVID in sweat samples of people with the infection.
So it's a very quick and reliable way of screening people.
So what does coronavirus smell like?
I wish I could tell you, but I'm not a dog.
Emily Rice, 9 News.
Well, getting that nasty swab up your nose to detect COVID-19 could be a thing of the past if all goes to plan. Yes, we've heard the horror stories. The swab supposedly touches your brain as you try and not sneeze throughout the process. But it soon could be as easy as breathing. An Australian company named GreyScan, who are based in Melbourne, have developed a 3-minute COVID-19 breath test. This could be our ticket to overseas travel, but it's just seeking government funding for mass manufacturing, with the aim to be rolled out by the end of the year. The COVID breath test will be used in airports, aged care homes and other locations to test if people are infectious with the virus. Aussies will just need to blow into a tube that is attached to a device, and the results will appear in just 3 minutes. The test is also aiming to not only increase testing numbers, but show just how infectious someone is and how quickly another can get the virus. And while the breath test has not yet been approved by health regulators, the company's CEO, Samantha Ollerton, told The Australian that it was promising. The breath test works in just under 3 minutes. This is still all laboratory testing, but the results are extremely promising. The next phase for us is commercialisation and mass manufacture. We are doing the rounds seeking government funding to help expedite the mass manufacture.
A Melbourne company has developed a world-first COVID breath test. It delivers results in minutes and could be a key to our borders reopening. Samantha Ollerton is CEO of GreyScan and joins us now. Sam, good morning. How does this breath test work?
Good morning. The breath test is very simple and actually removes all of the complexity of having to use very intrusive testing by relying on the sampling of individuals' breath. A bit like when we're used to having a breath sample by a roadside alcohol test. We then take that sample, place it into a device, and that device tells us within 2 minutes whether that person is actually infective for COVID or not.
Wow, this is amazing. So you say you now need funding to manufacture these kits. Have you had discussions with the federal government?
Absolutely. You know, we're getting a lot of advocacy and support from the various ministers because, after all, this affects everybody in every kind of different government department you can imagine, whether it be defence or health or industry. What we now need to do is take all of the hard work that we've done over the last year and translate it into a product that can be available by the end of the year.
Okay, so this could really be much speedier in opening up our international borders.
Absolutely. This is a game changer. I mean, fantastic news about the AstraZeneca virus vaccine. I think that actually what we need to do is implement a layered approach to this. Whilst we all need to take the vaccine, we also have to rely on antibody tests to test our immunity, but fundamentally understand the transmission and then the infectivity. A lot of the tests that are being used right now, you can't tell whether somebody actually has a dead or a live virus in their body. And to really truly open up, not just within Australia, but globally, that's what we need to do by introducing those global standards and starting in Australia first.
That's amazing. Sam Ollerton, thanks for your time. Good luck with this.
Thank you so much.